Thanks for coming, ladies. This is the last in-service of 2020. We're going out with a bang. The year started out with a bang. So this is going to be, I don't know if you guys ever did an in-service like this about care plans.
No. The traditional ones that.
Okay. So this is something a little different. Just because we're kind of noticing some things with when we issue out the care plans, there's some people that aren't reading them, and then it becomes a problem. So how about we just talk about the importance of the care plans and why we have them. So if you don't know, every home health agency, whether it's skilled or unskilled, every patient has a care plan. So when I used to do orientation for nurses and aides, how I describe the care plan is the patient's Bible. It gives you a breakdown of the basics at first, their name, address, phone numbers, and their diagnoses, which are right at the top of the care plans. I'm going to give you guys some copies. You can just kind of pass them down. These are care plans from our patients that we have. I just covered out the names. So those are VNA's care plans. And I did Xerox off for you guys.
Oh, this is one.
This is a blank care plan. I'm sorry, it's kind of small.
Okay.
This is a care plan, a traditional looking care plan from a skilled nursing agency that both the nurses and the aides use. So are you guys familiar with when I say skilled agency versus unskilled? If you need clarification, I can provide that. Okay. So skilled, I used to work at a skilled agency. This is my first unskilled agency, so there were some things I had to get used to, especially with the care plans. With a skilled agency, the patient's orders come directly from the medical doctors. So when we get a phone call from, let's say, Jefferson, Jefferson will call an agency and say, hey, I have a patient being discharged on X, Y, and Z day. This is the type of care he needs. And then the doctors will send over orders for the nurses. And we as the registered nurses or the nurse practitioners have to put together their care plan from start to finish. And it's usually very tedious, it's a lot of information, and usually the bulk of it is medications. It got tough when you're splitting the case between nurses and aides, because you have to put on the top, like the top of our care plan, it has their hours that they get per week.
Right.
So when there was aides and nurses doing the case, you had to put how many hours the nurse did. So let's say the nurses did 20 hours a week and the aides did 10 hours a week. You have to put that up there, and then you have to write not only the task for the nurses, but then the task for the aides. So it became a little much. It takes me and Claudia like a day to prepare a care plan. In a skilled agency, it can take up to a week. Because there's so much involved, and again, it comes from the doctor. So before we can even send staff out in a skilled agency, the doctor has to sign the care plan. So we would have to do the care plan and then fax it back over to that doctor, and they would have to fax it back. Now, if it was an emergency situation and they were coming out and they really, really needed a nurse or an aide that day, then there's some wiggle room. But usually the doctors always have to sign it before we send staff out. So that's the big difference. And obviously the level of care for the patients is a lot different in a skilled agency. You're talking someone that might be coming home with a cardiac cath monitor, some transfusions, IV therapy, so it's a lot involved. So, any other questions about that?
So the unskilled, basically, they don't need a doctor to sign off.
It's like what we got.
Right.
Yeah, I mean, I'm sure that's what we need, but I wanted to differentiate too.
Yeah.
Like, okay.
So for that, for the skilled, if you're working a skilled agency and you are an aide, your orders are coming from the nurse.
Right.
So the nurse creates the care plan specifically for you. But as far as the nurse that will go out in the field, because there's nurses that work in homes, I'm sure you guys know that, and there's nurses that do shift work. A lot of people are more familiar with nurses that come out and do wound care or assessments and stuff, but there's actual nurses that do shift work in the homes, meaning they're doing an 8-hour case or a 12-hour case. So their care plan comes from the doctor. But the nurse creates the care plan for the aide, so they share the case. So that's the difference. And so if you look at that care plan I printed out, most of the time for the aides, you're doing what you guys are doing here: housekeeping, laundry, errands. There's some cases where the aides, say that again.
Meal prep.
Oh yeah, meal prep. There's some aides that will work a 12-hour shift, so they're doing a lot. You're there for 12 hours. You're not just doing, you know, the basic care. They're doing cooking, cleaning. They're not doing any more housekeeping than what you guys are doing. It's not like just because it's skilled, we're taking down drapes. You're doing the same type of light housekeeping. But there might be some medications the aides are allowed to give in skilled agencies, but there's usually a test you have to take before you even do that, and the nurse has to monitor you. So that's where it would get crazy, because when I supervised cases with aides and nurses, you had to supervise the nurse, and then you had to supervise the aide. And they're never working together, and usually the nurse was on the night shift or the overnight shift, and the aide had the day shift. So you would have to supervise an 11 to 7 shift. So that's where it started to get a little, like, but it is what it is. I know at this agency there's been overnight cases before when I first started here, and I know some of you worked them. So, the wiggle room with supervising and unskilled is a little easier, but when you're on a skilled case, you have to physically be present with the aide. I know sometimes Claudia and I go out, and you guys may be food shopping, but if I would go out on a skilled case and the aide or a nurse was food shopping, I would have to wait. And you never know when time they're coming back. So, so you would have to wait. So, anyway, care plans are very important because it tells you as practitioners and aides and stuff what to do for that specific patient. So that's why when Claudia and I give you guys a care plan, or make a care plan and then the schedulers give it to you, we always encourage, please read it. I would say read it once, twice, 3 times in case you have questions. The big thing I had to get used to when I came here was before aides would go out, we had to talk to them over the phone and tell them exactly what was going on. But for here, it's a little different. We don't have to do that, but if there's a case where there's a lot going on, I do try to give the aide a call and say, hey, this is what you're dealing with. You know, especially if it's a case where it's, you know, there's combative family members, you know, there's lots of pets, there's some smoking going on. I always like to give a heads up, because sometimes you overlook that, because that's not on our care plan, it's on the back.
Right.
But what I try to do, if there's smoking, I try to put that on the front and highlight it, so you know. Like yesterday, I went to open up the case, and the lady smokes a pack a day. As soon as I walked in the door, I could smell it, and I said, I'm going to leave my coat and my sweater outside your door because I don't want it to smell like smoke. And I had to explain to her, when the aides come, the cigarette has to go out. And she was completely okay with that. But there's some people I know that are not. Hey, it's my house, I smoke when I want, but then we always run the risk of the aides might not want to be there if you're smoking. So.
With pets too.
Oh yeah, the pets too. Some cases I tell them, you know, you might have an aide coming that's a little afraid. Could you know, possibly lock up Sparky for the shift? Most of them are okay with that, but you get your some where they're like, no. So, but we always try to get preferences when you guys do become employees here of what you can handle, because some people can't handle dogs and cats because they're allergic to the dander.
Exactly.
So, you know, they try to be sensitive with that, but, you know. And now it's becoming a little harder because the case managers that give us the cases first are not going out at first. Like they used to go out, do an assessment, now they're doing everything over the phone. So like yesterday, that case manager would have told Marina and I, hey, she smokes and she has 2 dogs. I didn't find that out until I got there. So she told me about her dogs, but she didn't tell me about her smoking. So, you know, it is what it is. So anyway, so the care plan, the diagnoses are very important. In skilled agencies, every single diagnosis they have is on their care plan, and it can get very long. Here we kind of mainly put the major ones, like high blood pressure, diabetes is very important, any type of walking disorder, history of some cancers, we try to put that on there. Small stuff like GERD, I don't necessarily put on there because it's really not something that's going to become like a true medical emergency. I personally never heard of anybody getting rushed to the hospital because they're having an issue with GERD. But yes, if they have a high blood pressure problem or diabetes or even high cholesterol, history of blood clots, I try to put that on the care plan. I've had patients that aren't necessarily upfront with their diagnosis, so what I do is if I get that spidey sense, I kind of ask them, hey, can I see your most recent doctor's paperwork or hospital, and it's right smack dab in the front. And of course allergies are important too. Any type of food or drug allergy we put on there. Food's very important because sometimes people are allergic to things by scent. So let's say shellfish. I have one patient now that even if he smells it, he'll go into anaphylaxis. So I always tell remind the aides, hey, make sure you're not eating anything with shells before you go to this person's house because he could have a reaction. So that's important. And then for ours, I think the next section is the personal care.
No, personal care is first line.
Yeah, so personal care we always try to put on there. You know what I'm going to ask you, guys? If there's anything on that care plan that you would like us to maybe add or things that you think might need to come off, please give suggestions. Because I would like to redo our care plans because for one, I think I'm going to start typing them as opposed to handwriting because not everybody can read everybody's handwriting. Claudia has great penmanship. Me, sometimes I'm rushing, so I can kind of catch, hey, I need to redo that. So I'm going to start typing stuff, but there's some stuff on there that I think might be able to come off, or if you guys think we should add something, just give it a thought, because our care plan is front and back. So if there's anything you feel that, maybe we should be adding on there, just let me know, and, I'll always take your suggestions. But anyway, we try to put anything with personal care. And our orders come from the case managers. So the case managers will get a phone call from either the patient themselves or a family member, and they'll say, hey, I think Dad needs some home health aides, he's not walking real well, or he can't bend down and wash his feet. So then the case manager, their names go on a waiting list. And then they wait and wait and wait, and then they finally get a call that they're approved. So that's how we get the cases. So they tell us what the service orders are. They tell us what the hours should be. This goes for waiver and the options program. The main thing between waiver and options, obviously with waiver, they have way more than 6 hours. The county caps it at 6. There's some that have a few more hours, but it's usually very rare with the county options program. But with waiver, you can get up to 24-hour care, pending their level of need. So, but again, so the case managers go out, they do their own assessment, they, formulate with the families, like what such and such needs. They can kind of see for themselves what the patient needs because there's different tests they have to do. So that's when Claudia and I get the service orders, or the schedulers get them and they forward them to us, and that's how we make the care plan. What else is on the front? Shopping and errands is on there. Housekeeping duties we put on there in the front. What am I missing? I'm missing something.
Equipment.
Oh yeah, the equipment you're going to use.
That's mostly weird though. For the eyeglass section or the laundry, the last section.
I think there needs to be a bigger section for laundry. Specifically if you're going to a laundry. I know that's on there, but I think I want it to be bigger. Because laundry's a big thing with this agency. Like, there's a lot of you guys who do laundry sometimes for the whole duration of the 3 hours you're there.
Please put on it that we're not doing windows. We got a lot of problems.
Well, we always tell them when we open up the case what we're not going to be doing as far as housekeeping, because they'll ask. They'll say, hey.
They know, they just try.
Oh, they always try.
And the next aide, well, if she want to do it, it's on her, but
Right.
I'm not allowed to do it.
Right. And there's different agencies sometimes with some of these people, they have multiple agencies in. So some agencies, they expect their aides to get up on a stool and dust the top of the fridge, So if that aide's not there for that week, then of course the next one coming in, hey, you want to, no. So anything with ladders we don't allow. That's how I say it. If you have to climb up on the ladder, forget it. if you have to physically, like I had an aide the other day call and said, another aide, so this particular case, the mom has an aide and the daughter has an aide, but the daughter has an aide from another agency. That aide asked our aide, could she go up and take the shower rod off and clean? And of course she said no. And there was a kerfuffle, as always. So, you know, they will try to push it. Some of the family members and the patients themselves will always try to see what they can.
Against each. This ain't do it. Well, if she's doing you a favor, that's on her.
Right, right. So it's always important to pay attention to your care plan before you go out, the front and back, because for some reason some people miss the back. Claudia writes very detailed drive-in instructions on the back.
And that's good.
And it's from the office. When she
And
gives the
that's
instruction,
Right.
it's from the office.
Yeah, and me, I'm kind of, I write them, I'm a driver by memory.
Okay.
I don't memorize streets. I know where I'm going by,
Landmark.
yes. So sometimes I have to remember, they're not driving how I'm driving. So I will have to go on and do a Google map, and I try to pick the shortest duration. And what I always try to put on, in Norristown in particular, because there's days in Norristown where you cannot park on certain side of the streets because of trash and or street cleaning. They will tell you. I had an aide that was towed, but in my directions, and I was very specific, the day she was going was a Wednesday. You can't park on the left side of the street. What does she do? She parks on the left side of the street and she got towed. And of course she's calling here and I said, hey, look on the back of your care plan. You know, and I highlighted it and put it in red ink.
Well, why didn't she ask the person that she's going to visit?
I think she just didn't think of it. You know, she's not from that area. She's from out here.
No, I work in Norristown.
Right, so she didn't think, I think when there's street cleaning here in this area, they're not towing your car.
Oh,
Oh.
the
banging at the
last
window.
person.
Okay, of course, as soon as we start.